Hi everyone, welcome to Living a Balanced Life with Julio. On today's episode, we're going to talk about high cholesterol and some tips that can help you prevent heart disease, which is highly associated with high cholesterol. If you're interested, please stay with me. So, is cholesterol all bad for you? Cholesterol is not all bad for you because cholesterol is important for making some cell membrane. It's important for making some hormones that our body needs, like estrogens and testosterone. It's important for the absorption of fat from the food that we eat. But of course, too much of cholesterol can lead to a lot of problems and complications for our health. So cholesterol is there's two sources. You have 15 to 20% of cholesterol is made from it comes from the food that we eat, and the rest is made by our body. So 80 to 85% of cholesterol is made by our body. So our body makes cholesterol on its own, and this is why it's important for us to control the amount of cholesterol we're putting in, because even though it's important for us, our body is making majority of it, and 20% comes from the food we eat. So we need to be mindful not to put too much cholesterol in our body. So there's three types of fats that's important for you to know in terms of your cardiovascular health. Cholesterol comes in two forms. So you have the LDL cholesterol, which is the bad cholesterol or the lousy cholesterol, and then you have the HDL cholesterol, which is the good cholesterol. And then another type of fat that's important to know is triglyceride. Triglyceride is a type of fat that's also in our blood, and all these work together to help our body produce the important hormones that we need, but too much of it can also lead to cardiovascular disease. So the LDL, which is the lousy or the bad cholesterol, too much of it can cause plaque formation in our arteries, meaning that the fat will start to coat our arteries, making the arteries very narrow for blood to flow through. And if the artery becomes very narrow and you have very little space for blood to flow through, that can lead to high blood pressure, which in turn can lead to heart diseases and other cardiovascular disease. So when you have the LDL causing the plaque in your arteries, when a plaque breaks off from the arteries and it goes and block an artery that's feeding your heart, that's when you get a heart attack. If it breaks off and it goes and block an artery that's supplying blood to your brain, that's when it causes stroke. If you build too much of the LDL in your arteries, this is a normal artery, right? It's supposed to be open, supposed to be flexible for blood to flow through naturally. As your cholesterol increases, or your LDL, which is the bad cholesterol, increases, then you can start to see the plaque formation to a point where it's completely blocked. And when you go from a very clean artery to a complete blocked artery, that what happens is I see that all that fat that's blocking the artery is called it can lead to atherosclerosis, which means it makes your arteries very stiff for blood to flow through. It makes it narrows the space for blood to flow, and it can lead to clot formation, which can lead to heart attack, strokes, angina, and all of that. So the HDL cholesterol, we want that number to be lower. And then I mentioned another cholesterol, the HDL cholesterol. So the HDL cholesterol is the good kind of cholesterol, and what that does is it moves the cholesterol from your blood to your liver for it to be eliminated from your body. So the higher your HDL, which is the good cholesterol, the higher they are, the better your arteries is plugged with fat, right? So the HDL cleans your arteries because it moves cholesterol away from your body to be eliminated by your body, so it doesn't cause plaque formation. But I also mentioned another fat that we need to be mindful of, the triglyceride. So triglyceride is a type of fat, and it's also in your blood. And usually people that consume high amounts of alcohol or eat a lot of sugary foods, your body turns all of that into triglyceride. So when you drink a lot of alcohol and you eat high sugary food, your body turn it on to triglyceride, and that's is stored in the body. And when it's stored in the body, it does the same thing as the lousy cholesterol, the LDL. It causes plaque formation, and plaque formation, as we have learned, is not good for us. It can lead to a lot of problems. So when your doctor is checking to see if you're at risk for like your cardiovascular risk, they look at your overall cholesterol ratio. So they're looking at the ratio of the good cholesterol versus the bad cholesterol, and that tells us if you are someone that's at higher risk of getting heart disease from high cholesterol, or if you're okay. There's a number of things that can cause a person to have high cholesterol. like I said earlier, 15 to 20% of cholesterol is taken from the food that we eat, and 80 to 85% is made by our body, right, for other bodily functions. So if you're someone that is consume a lot of highly fat foods, like a lot of saturated fat, a lot of deep fried food, if you drink a lot of alcohol, if you're someone that smokes, if you're someone that doesn't do any exercise, if you carry your weight mainly around the abdomen, all of this puts you at a higher risk of high cholesterol, or your cholesterol being high to lead to cardiovascular diseases. So these are some of the risk factors. Of course, gender plays a role, and our age plays a role. So men tend to have more, high cholesterol more than women, but as we age, women, especially when they close to menopause, or they go through menopause, the cholesterol level starts to go up. Right, so because as women goes through menopause, some of the hormones that our body is making, it's not making as much. So like the estrogen, it's not making as much. So the cholesterol is sitting there, and it can cause heart disease and all of that stuff. So it's important to know your risk factor, right? It's important to know where you're at. Usually if you're someone over the age of 40, it's a good idea to get your blood work done to see where you're at in terms of your cardiovascular risk. So to get cholesterol, to check for cholesterol, it's blood work that you get done, and based on that blood work result, we'll see how close you are to cardiovascular, how high your cholesterol is, and then what kind of measurements you need to do to prevent cardiovascular diseases, right? Having said that, sometimes because everything that happens, especially most diseases, have genetic predisposition. So that means if you're someone that have cholesterol run in your family, you're going to have high cholesterol, right? It increases your risk of getting high cholesterol. So even though some people eat very healthy and they exercise and doing all the good habits, there's a chance that you can still have high cholesterol, because like I always say, we don't choose our parents, we don't choose our family, we get what we get. So if that runs in your family, it increases your risk of getting cardiovascular disease. So it's up to you and your doctor to decide. If your doctor do a screening test to find out if you are somebody in your family have, let's say, hypertension or diabetes or other cardiovascular disease, or if a family member died from a heart attack or stroke, that puts you at a greater risk of getting high cholesterol that can lead to other cardiovascular disease. So in that sense, your doctor will be monitoring you more closely with blood work to make sure that your cholesterol is not going towards, or the LDL, the bad cholesterol, is not going too high, and that there's measurement you're putting in place to increase the HDL cholesterol, which is the good one that clears all the bad cholesterol from your blood. So having said that, the management of cholesterol is lifestyle changes and also medication. So sometimes if a person, if your doctor does your blood work and your cholesterol is moving a little bit high towards the high side, what they will recommend that you do is you do a lifestyle change. So the lifestyle change is the things that I talked about that puts you at risk. So if you're someone that doesn't exercise, making sure that you're exercising will help you reduce your risk of increasing your cholesterol. If you're someone that doesn't eat healthy fat or don't eat a balanced diet, that can put you at risk. So one of the things that you can do to prevent HDL from going too high, or from triglyceride, which is the other fat, from going too high, is being mindful of the type of food that you put in your body, right? So making sure that you're not eating a lot of deep fried food. If you're not cooking with a lot of oil. If you're going to choose fat, choose healthy fats, because fats, it's good for us. We need the healthy kind of fat, like from avocado, from fish oil. Those are the kind of fat that helps get rid of cholesterol and help increase the HDL cholesterol, which in turn will help get rid of the bad ones. So making sure that you're eating a balanced diet is important. Eating high fiber food, right? What fiber does is fiber acts like a broom to sweep all the cholesterol from our blood for it to be eliminated. So the higher you consume of high fiber food, the better your cholesterol becomes. So high fiber food, especially the soluble fiber, the type of fiber that's found in oats, okra, those are the type of fiber that will help get rid of cholesterol and improve your blood cholesterol level, therefore decreases your risk of cardiovascular disease. So if you are going to eat, of course, choose high grain complex carbs. Complex carbs are carbs that are less processed. Complex carbs are carbs that are whole grain, so you're eating the whole grain and not just the processed part of the grain, which cause our blood sugar to go so high, right? So these are some of the tips. Also, we talked about alcohol, making sure that you are watching how much alcohol you're putting in your body, because drinking too much alcohol will make your triglyceride, the other fat in your blood, go high. And when that goes high, it starts to plug the artery the same way as the bad LDL cholesterol, right? So making sure that we're not eating high processed sugary food like cookies and cakes and all the desserts, right? Once in a while you can have those things, but if it becomes a routine where you're constantly eating high sugary food, that can lead to a buildup of triglyceride and LDL. So making sure that we're eating complex carb, high fiber carbs is good for us. Also making sure that if we smoke, we quit smoking, because when we smoke, it causes our blood pressure to increase. And when your blood pressure increases, it can it can increase your risk of getting high cholesterol. And like I said, remember, your artery is being plugged by the high cholesterol and it's blocking the artery, making it very hard and stiff. So it's not, as blood is not easily move through your arteries like it's supposed to. So if you have that plus high blood pressure, that pressure from the blood can break the plaque, which is the fat that's blocking the artery, and it can go anywhere it goes. It can lead to complication. If it blocks an artery in your heart, like I said earlier, it can lead to a heart attack. If you block an artery going to your brain, that's stroke. If it goes into the arteries that's going to your lung, it can lead to pulmonary problems. So it's very important that we look at the overall health. Everything we're doing influences our health. So choosing good food, choosing high grain food, making sure that we are not eating a lot of processed food can help us improve our cholesterol level. Another way is, of course, losing weight. If you're someone that needs to lose a little bit of weight, every little bit of weight you lose help improve your cholesterol. So normally, whatever your body weight is now, losing about 5 to 10% of it can do a number for your blood cholesterol. It can lower your blood pressure. It can lower your chance of getting heart disease, and lower your chance of getting diabetes, right? So all of this is like interconnected, right? It starts with you building the plaque in your arteries. You have high cholesterol, that leads to, then you see blood pressure, high blood pressure comes in. And when high blood pressure comes in, and if you're someone that's genetically predisposed to diabetes, meaning that you have a family history of diabetes, or your lifestyle puts you at risk of diabetes, then diabetes sets in. And that combination of all of that, it's very hard on our body, right? So if your artery is like this, blood is flowing perfectly and you're able to get all the nutrients and the benefits that you need from your blood to survive. If your artery plugs like this and you have high blood pressure and high blood sugar, the sugar, think of syrup. Whenever your blood sugar is high, it's like your blood become very thick. And when your blood become very thick, it can move freely, like it moves very slowly. So now you have blocked artery with thick blood with high pressure pushing it through. This is what leads to all the cardiovascular risk and all the cardiovascular diseases. So it's very important that we take care of ourselves. We know where we're at in terms of our cardiovascular health, right? Talk to your doctor or your healthcare professional about, just say, should I worry about my cholesterol, or what's my cholesterol level? If they haven't checked, this will remind them to get you checked. If you're somebody that's high risk, tell them that, I have a family member that has this and this and that puts you at high risk, so you want to know what your cholesterol number is. So knowing what your cholesterol number is important, because that will help you determine what kind of treatment, right? So we talked about the 3 different types of fat in our blood, and the lifestyle changes is great because in combination with medication can help you move your body away from all the cardiovascular issues. So for example, if you're someone that have high LDL, which is the lousy or bad cholesterol, then your doctor can put you on medication. The group of medication, the number 1 medication we use is statin. And statins are great medication to help you get rid of the bad cholesterol, right? So it starts to remove the plaque from the arteries, where it starts improving to a point where you're back to normal, where your arteries are clean, right? So the statin medications are very important. If you have high cholesterol and you have a family history of cardiovascular disease, then most of the time your healthcare provider will put you on statin medication. Another way of boosting our HDL, which is the good cholesterol, we want that one to be high. The good cholesterol is taking eating foods that have a lot of vitamin B in it, or taking the medication or the supplement for vitamin B, because the vitamin B help boost the your HDL cholesterol about 40%. So if that's boosted up, what that's doing is it's getting rid of the bad cholesterol to be eliminated from your body, so then you can start to function the way you're intended to function without all the other problems. So that's the management of the HDL. And then with the triglyceride, the other fat that's in the blood, fibrin is the type of medication that usually is used to also cause that to go down. So if you're somebody that drinks, if you're somebody that eats a lot of sugary food, reducing that to a point where you're stopped and you're choosing healthier food will help you with your triglyceride level, right? Having said that, high sugary food not only is going to cause your cholesterol to go up, will cause your blood sugar to go up, and it can in turn will cause your blood pressure to go up, putting you at risk of cardiovascular disease. So it's important that when we're doing whatever we're doing, we're looking at the whole our whole health, right? What we're doing for ourselves, we're doing it for our children, we're doing it for our family members, because we all belong. If one family member is at risk, it puts you at risk as well. So when you are eating healthy and making the healthy choices, get the family involved so everybody's benefiting from ways to prevent high cholesterol. So I talked about some of the risk factors. So making sure that you know your risk factor is important, because cholesterol doesn't come with any symptoms. So it's not like diabetes where you start to have some symptoms, or high blood pressure, you start to have some symptoms. Cholesterol, there's no symptoms until your doctor does your blood work. You probably wouldn't know that you have high cholesterol. So it's important to know if you fit in the risk factors. So the risk factors of cholesterol, like I said, if you're someone that's eating like fast food, high trans fat and saturated fat food, that puts you at risk. Being the age of 60 plus puts you at risk for any gender, male or female. Family history puts you at risk. If you are someone that smokes, it puts you at risk. If you have diabetes, it puts you at risk. If you're someone that's inactive, so you don't exercise at all, that puts you at risk. So if you find yourself with, if you can identify with some of the risk factors that I just mentioned, then it's a good idea to have your doctor check. Even if you're not close to the age of 60 and you feel like you have some of these risk factors, it's important for you to get your blood cholesterol check. And it's usually once a year. You go for blood work, they check it, and they let you know where you stand. And then based on that, they either say start your lifestyle changes, and then with combination of medication that I mentioned to help you manage your cholesterol. So it's important to know your cholesterol number. So for the bad cholesterol, which is the LDL or the lousy cholesterol, we want that number, especially if you're someone with diabetes, we want that number 2 millimoles per liter or less, right? Because when you have diabetes, your heart is already working, overworking. So we don't want the cholesterol to make your heart work faster. Having diabetes puts you at risk of having heart attack, right? So diabetes is a risk factor for heart attack. So it's important that if you have diabetes, to keep your cholesterol, the bad one, under 2 millimoles per liter. The HDL cholesterol, we want that to be over, because remember, that's the good one, so we want it to be more. So we want that to be over 1.2 millimoles per liter. And then the triglyceride, which is the other type of fat that's in your blood, we want that to be lower, because that also causes plaque formation in your arteries. We want that to be lower than 1.7 millimoles per liter. So when we put all of that together and we look at it, give us the total cholesterol, which is, it should be under 5.2 millimoles per liter for an individual, especially if you're someone that has high blood pressure, diabetes, and all those other things that we talked about. So you don't have to memorize these numbers. It's just good for you to know that you're at risk if you are, and then what to talk to your doctor, get blood work done, know where you're at, so it can help you move away from getting heart disease. Because most of the time, someone just had a heart attack and they were very healthy. Well, it seems that way, but like I said, there's no symptoms of high cholesterol, so otherwise you wouldn't know. So always go see your family doctor at least once a year. Go for a complete physical where they're checking all the different markers, checking for if you're at risk for diabetes, for cholesterol, for blood pressure, screening to make sure that you're in good health. And if something is found early, then you could do something about it to help you prevent complications and help you live a healthy, balanced life. So until next time, try some of these tips. Know where your cholesterol level is. Eat very healthy, include good fats. The omega-3 omega 6 and 9 oil that's found in fish and in good fats like avocado. Include that. Include high fiber grains and starches, complex carb. Boost your fiber intake by adding flax seeds and chia seed and all the different high fiber foods in your diet. Introduce a lot of greens into your diet that will help you get rid of the bad cholesterol to boost your HDL, which is the good cholesterol. A lot of people sometimes ask me, what kind of vegetable? All vegetables are good for you, but some vegetables have high fiber in terms of the type of fiber that clears your cholesterol. So eggplants are one of them. Okra is one of them. Oats is one of them. All of those are important to include in your diet and to help you improve your HDL, prevent yourself from getting heart disease, heart attacks, strokes, angina, and diabetes, high blood pressure, and all the other complications that's associated with having high cholesterol. So until next time, take care. Please subscribe to my YouTube channel. If you're new to my channel, welcome. Watch my other videos so you can learn some tips to help you improve your life. If you're not new and you've been following me, thank you. Share my videos, share on your social media platforms, share with your friends and family so we can all work together to live a healthy, balanced life. Until next time, take care.